This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. Dave Wilson with you. It's our Father's Day show. So naturally, we have a couple of gynecologists joining us on the program. It'll all make sense. Just follow me on this one. Joining us this morning, our guest, Dr. Shane Prettyman, obstetrics and gynecology with Mon Health. Dr. Prettyman, good morning.
Good morning. How are you?
I'm doing well. And Dr. John Sunyecz, gynecology with Mon Health. Dr. Sunyecz, good morning.
Hey, good morning to you.
Well, guys, I appreciate you coming on, and I kind of jokingly said nothing says Father's Day like talking to two gynecologists, but we'll make sense of it because we're going to talk about the father's role, dad's role, as it comes to women's care, and obviously what he can expect and how he can be of assistance throughout the entire pregnancy process. But first, we will talk to you two about you two. So, Dr. Prettyman, we'll start with you. Just give us a rundown a little bit about your background and how you ended up working with Mon Health.
Sure. I grew up in Charleston, West Virginia, did undergrad in medical school in Morgantown, went away to the University of Virginia for residency, where I did OBGYN, and then ended up back in Morgantown. We had our first child when I was there in residency, and after you finish residency, you kind of think, where in the country do we want to go? And my wife with our 1.5-year-old said, we're moving back to Morgantown. You can come with us if you want. So that led us back to Morgantown. That was 2011, and I've been here since. And
Dr. Sunyecz, same to you. Talk about your background a little bit.
Sure, thank you. I grew up in Northeast Ohio near Akron, Cuyahoga Falls. I went to Ohio State for undergrad as well as medical school, and then I went to McGee Women's Hospital for my residency. Had our twin sons there when I was a second-year resident, and that was a wonderful experience. And after I was done with my residency, we wanted to stay close to Pittsburgh, but not right in the heart of the city, so we found a great opportunity in Uniontown. Love the area, and have been here since. Joined Mon Health in 2019. It's been a great experience thus far, and I've enjoyed my time.
And Dr. Prettyman, why gynecology and obstetrics? What made you choose that specialty?
Yeah, well, I always, as I was progressing through medical school, always thought I wanted to do something surgically. But then when I was a third-year medical student, that's when you get to experience all the different, specialties. I was, doing my OBGYN rotation and just kind of discovered this obstetric part of it where you're with the family on the greatest day of their life. And I had not yet had a kid, but just, kind of got wrapped up in the joy and the satisfaction and just of that moment. And I thought, man, if I could be doing this every day for the rest of my life and, assisting families, through this journey, there's nothing more gratifying than that. So just kind of fell in love with that. And, OBGYN is such a wide variety of not just obstetrics, but gynecology, inpatient, outpatient, a lot of variety, and really get to, form bonds with families. So just very gratifying field.
Dr. Sunyecz, same to you.
Yeah, I would mirror what Dr. Prettyman said. I kind of thought the specialty was, out of all the ones that you rotate through when you're in medical school, the one that had the most diversity. It offers a great opportunity to practice the medical side of things, but then you also can help to take care of those patients if they have a surgical issue. So you have a nice mix between the two. And the relationships you develop, generally you see patients year in and year out and follow them as they grow and their families grow and really get to know the patients well, and that's gratifying as well.
All right, I mentioned today is kind of like our Father's Day show since yesterday was Father's Day. A lot of this is going to be aimed at particularly new fathers or new fathers-to-be. Dr. Sunyecz, okay, after you've gotten over the initial shock that you're going to be having your first baby, kind of explain from a father's perspective, what's the journey like here over the next several months, and what's the process going to be for he and the mother?
Yeah, I think it's a team effort, right? So when my wife was pregnant with our twins, we were in the midst of a very busy time. Like I said, I was in my residency, but with fathers in all positions, everybody's busy at that time in their life, but you got to be there to support each other. It's going to be an emotional roller coaster, but I think if you can participate as a team and be there to support you both emotionally as well as just putting the time in, it's a great experience, something that you'll have for the rest of your life.
And Dr. Prettyman, as far as, mom's going to have to go through doctor's appointments and checkups, and there's going to be a lot of things down through the line. So, again, from the dad's point of view, where are you supposed to be? What's your role as this journey takes place?
Yeah, I think, for a dad, and, Dr. Sunyecz and I, see this, not only through professionally how we do this, but, through our own experiences. Guys are a little bit different in that they're not experiencing, the pregnant belly and every other million side effect that goes along with pregnancy. So, we see our wife grow, we see the ultrasounds, you're along for the journey, but sometimes it's not really real until you get to the delivery room. But, for the first 9 to 10 months during pregnancy, like anything in life, you get out of it what you put into it. And, I think coming to the doctor, for the dad, coming to the doctor's appointments, being there, seeing definitely the ultrasounds, but just all the appointments, getting a book, asking questions, really trying to get into, what is this pregnancy thing about? It's easy just to be along for the ride, but if you really get into it and get involved with it, I just think the end product is so much more meaningful, and the journey is so much more meaningful. So I think just get involved as much as you can.
All right, Dr. Prettyman, you mentioned the delivery room, the days of dad sitting out in the waiting room and then handing out cigars later, long gone. So on delivery day, the baby's coming. What's the dad's role? Where can he be? What should he be doing?
Yeah, well, like any good husband, just sitting there saying, yes, honey, and doing whatever she says for the most part.
That's a good rule of thumb in general.
Exactly, life lesson. So I think a lot of times the dad, it's a very anxiety-provoking situation because, as dads and men, right, we're supposed to fix situations and make things better. And a lot of times you almost, and I know this, personally, my first delivery is a very difficult delivery for my wife. And you sit there kind of helplessly. I couldn't do anything about, the heart rate issues for the baby and was it going to end up as an emergency C-section or not. And, her epidural wasn't working at all. And, it's anxiety-provoking. So I think just, kind of be there, hang on for the ride, and, the end result, once that baby comes out, however it comes out, it is amazing. And, I delivered a baby I was on call this weekend, delivered lots of babies this weekend, but one of them particularly, I was just kind of sitting back, observing the mom and the dad right after the baby came out, like I always do. But it just hit me how much sometimes if we're not careful, we as healthcare providers can take this for granted. But this dad had never really seen the baby, had never felt the baby. He knew he was going to have a baby, but when it actually came out and it's sitting there on the mom's chest and he's touching it and the look on his face, it just kind of hit me that this is so special what I'm getting to be part of right now for this family, because this is really his first time of realizing that, oh yeah, this is real. We have a baby. I wasn't ever really aware of it. I saw her belly growing, like I said, but this is it, and I can touch the baby now. And I think right then, that's when it clicks for dads, I think more so than the 9 to 10 months of pregnancy. It's right when that baby comes out, and it's a beautiful thing.
Dr. Sunyecz, can you kind of explain what will go on in the process, arriving at the hospital, and then the delivery process itself? Kind of explain what will happen there.
Well, yeah, I think probably Dr. Prettyman could speak to that a little bit more than I, since I practice gynecology. But I can tell you that the patients that I've seen in their postpartum time frame, the team from an obstetric standpoint is phenomenal. The whole labor experience that I've had feedback from patients is wonderful as far as the time, the how the team looks at both the patient as well as her partner, the husband, and is kind of together and involves the father as well. So I've been very pleased to hear that from patients, and I think Dr. Prettyman can answer the question more about the process coming to Mon and how that's going to work.
All right, Dr. Prettyman, kind of give us an overview of what happens once you arrive at the hospital.
Yeah, so something's going to take you to the hospital. Either your water's going to break, you're going to go into labor, you're going to need to do something like that. So you get to the hospital, you and your partner, you head back to your room, and, you're in a nice big labor suite. You're in that room basically from the moment you step in the building to the moment you leave for the most part. So you labor in that room, you deliver in that room, you recover in the room for the next 1 to 2 days, and then you go home. So the two of you guys are in this nice room together. It's kind of your little house for the next few days. It's a very beautiful, comforting kind of environment. You go through the process of having the baby, right? The dad is sitting there, beside of the mom the entire time. And, if the mom elects to get an epidural, the dad can and can sit there, with her the whole time. They never have to leave the room. The delivery happens. The providers are there. The nurses are there. The pediatricians, are present. If the mom ends up needing to have a C-section, the dad will be with her the whole time. During the C-section, she's awake, he's sitting by her side, the baby's delivered. He walks right over, 5 feet away to the warmer to see the baby initially, as the nurses are assessing the baby, and then they wrap the baby up in a blanket and bring the baby right over to the mom, and he's sitting right there beside of her, holding the baby and helping to support the baby on the mom. And then, mom and baby go back and dad go back to her room. Again, this is if it's a C-section. If it's a vaginal delivery, they've been in the room the whole time. And then, pediatricians will observe the babies for the next 2 days just to make sure everything is happy and healthy and do all the testing they need. The baby's with the mom and the dad in the room the entire time. So it's just, you come in, you have a baby, you're together, and you go home, and all of a sudden you have a family.
Before we take the break, do you get a lot of, not just dads, but maybe families in general, when they come in for the experience of having their baby, especially first-time parents, are they surprised at what the process is now compared to maybe what they had in their minds?
Yeah, I think so. Yes, you're right. I think back in the day of, the delivery room, or I think more so, and even in the movies, it's, all the babies are in a nursery and there's a big window and you got to look through the glass, and you're waving at your baby. You're not sure which one's your baby, right? I mean, those days obviously are long gone. So it's pretty great. I think, a lot of times, pre and post COVID, I think it's really special when the baby is, there are allowed to be visitors, and there can be visitors in the room during the delivery. A lot of times it's, mom or sister or somebody who's in the room at the delivery. But it's kind of neat sometimes when it is just, the mom and the dad, and sure, a support person too. But, the way that, the extended family who's there along for the journey. And I, imagine myself with my, daughters and, kids are having babies one day, but, they're out in the waiting room and they have no idea what's going on. The mom and the dad, they know everything is fine and all is good. And they're sitting there bonding with their baby, immediately when the baby comes out. But, the parents in the delivery room or the grandparents in the delivery room, no idea. And it's kind of neat to, sometimes, I'll walk out to the delivery room while the mom and the dad are with their new baby just to let the extended family out there know that everything is fine. And just, the look on their face and the joy and the excitement and the relief that everything is okay. It's pretty neat. It's a great experience.
Dr. Shane Prettyman, obstetrics and gynecology, and Dr. John Sunyecz, gynecology with Mon Health, our guest this morning. We'll continue our conversation. Got to take a quick break. We'll be right back. This is Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Shane Prettyman, obstetrics and gynecology, and Dr. John Sunyecz, gynecology. And Dr. Sunyecz, all right, so the baby has arrived, and now it is that postpartum journey, especially for the mother and the baby as well. So where is Dad's place in this journey, and how can he be of assistance for mom and the baby?
Yeah, I think it is a ride. It's certainly something that you have to be there for your partner to help with the the duties that are there for the newborn. So, being part of a team, as I had mentioned earlier, and dads can be there to support the moms and the babies with learning to help with child care, helping to basically at the end of the day, if you're going back to work and the mom's at home with the baby and you walk in the door, you can just look at the mom and say, yeah, I'm going to take the baby. You go to take a 20-minute walk, and so you have to just kind of read the situation. And once again, it is an emotional roller coaster from a hormonal perspective for the mom. And so you really want to be there, but you also have to enjoy the ride, right? It's a great time. It's something that flies by at the end of the day, and you want to be there to help mom as much as you can.
And Dr. Sunyecz, I say this a little bit jokingly. When I talk to physicians at Mon Health, where we're talking about, dietary issues or getting surgical procedures done, you don't just send the patient home and say, good luck with that. It's comprehensive care. So what does postpartum services or postpartum offerings look like at Mon Health? How will you be there for the mom and the baby and the family even after delivery?
Yeah, well, you're exactly right. I think one of the great things that the obstetrics team does is it monitors for postpartum depression, because we know, as I had mentioned, some of the hormonal changes. It can be a tough time. You have a lack of sleep. It can really play a role for how moms are dealing with the whole postpartum time frame. So there's a very active component of the postpartum care that screens for postpartum blues, postpartum depression, and can actively treat that. The pediatricians are certainly involved with the newborn and helping to take care of that. And the more that the dads understand what options and what services are available, if there is a little bump in the road, a little hiccup along the way, then the dad can be engaged and involved in helping to get over that process and help the whole situation. Because really it's the family at this point, and you have to take care of all members, the newborn, the mom, and then dads need to take care of themselves too, and understand their role.
Got about 20 seconds each for you here before we got to wrap up. I'll start with Dr. Prettyman. Any fatherly advice for expectant dads out there in the audience?
Just be there, be supportive. Realize that a mother goes through a lot, and we need to treat them differently than we do on a different normal basis. So it may be that she's getting up to breastfeed in the middle of the night, and sure, there's nothing I can do to help my wife in that circumstance, but I can get up, see if she's doing okay, see if she needs a drink of water, and help her out with that, as opposed to just sleeping through the night. So I think it's the little things to try to be thoughtful, or what you can do to help support your partner.
And Dr. Sunyecz, about 20 seconds. Any advice?
Yeah, enjoy the ride. Growing, the time flies, like I had mentioned. So, enjoy the situation. I always think that if a child's raised in a loving, caring, respectful environment, they'll be most likely to be loving, caring, respectful humans as they grow up. So, be there for your kids.
Dr. John Sunyecz and Dr. Shane Prettyman. Guys, enjoyed the conversation. Thanks so much for being part of the show today.
Thank you.